Colon cancer is a leading cause of cancer-related deaths in the U.S., with over 50,000 lives lost annually. Colon cancer is a growth of cells that begins in a part of the large intestine called the colon. It usually begins as small clumps of cells called polyps that form inside the colon, which can turn into colon cancer over time. Therefore, doctors recommend regular screening tests. In this video, we will talk about early signs, as well as lifestyle changes and diets for people suffering from colon cancer. This video is meant for educational purposes only and is not a substitute for professional medical advice. Number 1. Changes in bowel habits. One of the first signs people often notice is a change in how often they use the bathroom. Maybe you're going more often than usual or not enough. If you've always been regular but now have constipation or diarrhea that lasts more than a few days, it could be a red flag. These changes may not always mean cancer. Many things can cause them, like stress or food. But if this becomes your new normal, it's worth getting checked. A tumor in the colon can block or narrow the passage, affecting how the waste moves through your body. Number 2. Blood in your stool. Seeing blood in the toilet can be scary, and it should never be ignored. Sometimes it looks bright red. Other times, your stool may appear darker, almost black. This can mean the bleeding is happening deeper inside your colon. It's easy to think it's just hemorrhoids or a minor injury, especially if the bleeding isn't painful. But if this happens more than once, or you also feel tired or dizzy, you should talk to your doctor. Blood loss can lead to anemia, which brings its own set of problems. Number 3. Unexplained weight loss. Losing weight without trying might sound great at first, but when your pants suddenly feel loose and you haven't changed your diet or started working out, that's a concern. Cancer uses up your energy and can change how your body absorbs nutrients. Even if you're eating like normal, your body might not be getting what it needs. This kind of weight loss often sneaks up on people. They notice it only when others start to mention it. Number 4. Feeling tired all the time. Fatigue that doesn't go away, even after a full night's sleep. It can be a quiet sign of colon cancer. This kind of tiredness isn't just about being sleepy. It feels more like your body is weighed down. This happens because your body may be losing blood slowly over time, causing anemia. Or the cancer itself may be using up your body's energy. Either way, when your usual energy just isn't there anymore and you can't explain it, it's time to listen to your body. Number 5. Cramping or belly pain. Everyone gets a stomach ache now and then. But if you're having frequent cramps or stomach pain that doesn't seem to go away, you should pay attention. Colon cancer can cause pain as it grows. Sometimes the pain feels like pressure or it comes and goes. It may also feel sharper after eating or during a bowel movement. If the pain is in the lower part of your belly and sticks around, it's worth getting checked. Number 6. A feeling that you haven't finished. Have you ever gone to the bathroom and still felt like you needed to go again? That's called Tenesmus, and it's another warning sign of colon cancer. When a tumor grows inside the colon or rectum, it can make you feel like there's still more to pass, even if there isn't. It's uncomfortable and frustrating. This feeling may show up even when your bowel movements seem normal. The sensation is a signal that something's not right inside. Number 7. Narrow or thin stools. If your stool starts to look pencil thin or more narrow than usual, and this continues for several days or weeks, it could be a sign that something is blocking the passage in your colon. Narrow stools can sometimes be harmless and caused by changes in diet. But if they stick around or come with pain, blood, or other symptoms, it's a good idea to check in with your doctor. This kind of symptom is easy to overlook, but your body is trying to tell you something. Number 8. Nausea and vomiting. If your colon is partly or fully blocked by a tumor, it may cause nausea and vomiting. This is more likely in later stages, but it can also happen earlier in some cases. You might feel sick after eating or have a loss of appetite. Your belly could feel bloated or full, even when you haven't eaten much. These are signs that your digestive system isn't working the way it should, and they can be especially serious if they come with other symptoms mentioned above. Lifestyle changes for early-stage colon cancer patients. If you notice any of the signs mentioned above, you should see a doctor. And if you've already been diagnosed with colon cancer, don't lose hope. There are things you can do to help your body fight back. Making positive lifestyle changes can make a big difference. But before doing anything, it's essential to get advice from a medical professional, because these things aren't a cure. Even a little movement every day helps. Walking, stretching, or gentle exercise boosts your energy, improves digestion, and lifts your mood. You don't have to run a marathon. Just aim for 20 to 30 minutes of movement most days. Staying active helps reduce inflammation and supports healing. If you're feeling too tired, start small. A short walk after dinner can help you sleep better and feel stronger over time. The goal is consistency, not perfection. Eat a colon-friendly diet. Food plays a huge role in your recovery. A colon-friendly diet includes more fiber. Whole grains, fruits, and vegetables help keep things moving through your system. Less red and processed meat. These can irritate the colon and may increase cancer risk. Healthy fats. Try avocados, nuts, olive oil, and fish like salmon. Plenty of water. Staying hydrated keeps your digestion smooth and supports every cell in your body. Also, try to eat smaller meals more often if large meals upset your stomach. Listen to your body and talk to a nutritionist if you can. Quit smoking and limit alcohol. If you smoke, quitting is one of the best things you can do for your health. Smoking doesn't just harm your lungs, it also affects your colon. It can slow down healing and may make cancer grow faster. Alcohol can also irritate your digestive system. Try to cut back or quit if possible. If you do drink, limit it to 1 drink a day or less. Manage stress. Being diagnosed with cancer is emotional and stressful, but managing that stress helps your body heal. Try things like deep breathing, meditation, journaling, or talking with a friend or counselor. Stress can affect how your body works, so finding ways to relax is part of your treatment. Some people find comfort in art, music, or even gardening. Others prefer quiet time or prayer. Whatever helps you feel calm, make space for it. Keep up with medical care. It might seem obvious, but going to all your follow-up visits is key. Your doctor may check your blood, scan your body, or recommend new treatments. Even if you feel fine, these visits catch problems early. Also, don't be afraid to ask questions. Write them down if you need to. This is your health, and you deserve to understand everything about it.